So this study is looking at thin ALT flaps and skip flaps versus regular ALT flaps for lower extremity reconstruction and looking at the current evidence that's available in the literature. This is being done under the Division of Plastic Surgery at Western University, and the project supervisor is Dr. Andrew Simpson. I myself am Khalifa AlGhanim. We're also going to be hearing from Erica and Kaveh today. So we're going to start off looking at the clinical question. It was quite simply whether thin ALT and skip flaps have comparable results to regular ALT flaps in patients that require lower limb reconstruction. So we're going to primarily look at what exactly a flap is. It's a variety of tissue from one side of the body with its blood supply intact that's moved to another site for coverage or to cover a defect. In this study itself, we're going to be looking at free flaps. Free flaps are the tissue island that's separated from its original blood supply and then reanastomosed or reconnected to another blood supply at the site that requires coverage. So how do we do that? So when we're harvesting the flap, you can see that we remove the skin with the underlying structures, be it the fat, be it the fascia, the muscle, or even sometimes the bone, along with an artery and a vein. So the artery is there to supply the blood to the flap, and the vein is there to remove the blood. That's removed from one area and then implanted into another area. And as long as there's blood going in and out, the flap should survive. However, in some circumstances, the flap on the left looks quite healthy and pink, but if there's an inlet or outlet problem in which there's an issue with blood going in or the blood going out, the flap might not survive. And as the image on the right shows, we end up with something called flap failure, albeit entirely or just a small part of the flap. With that, we're going to talk about the different flaps, and I'm going to hand you over to Kaveh.
Thank you. The anterolateral thigh flap was first described by Song et al. In 1984. Since then, the ALT has become a workhorse flap in the reconstruction of upper and lower extremity, cranio-orbital-facial, and perineal reconstruction. Advantages include a large tissue yield, pliability, a long pedicle with a large vessel caliber. Additionally, these flaps can also be modified to include fascia, adipose tissue, or muscle, depending on the reconstructive need. One disadvantage is that depending on patient factors such as BMI or the location of the reconstruction, subsequent flap debulking may be required to reduce the flap thickness. Recently, newer flaps have been described that are harvested above the layer of the deep fascia and provide several important benefits in reconstruction. Two such flaps are the thin ALT and the skip flap. The thin nature of these flaps makes them a promising candidate for the reconstruction of anatomical locations such as the dorsum of the foot, in which the goal is to minimize contour irregularities and to preserve function by reducing the need for subsequent debulking. While the ALT flap is well established in lower extremity reconstruction, the thin ALT and the skip flap are less well studied. The aim of the study is to conduct a systematic review to appraise the available literature on the skip and thin ALT flaps compared to the regular ALT used in lower extremity reconstruction. The primary outcome measured was flap survival, with other complications measured as secondary outcomes. Outcomes were stratified by anatomical location of reconstruction and the defect etiology for thin ALT and skip and regular ALT flaps.
So now let's look at the methodology. We searched through these different 6 databases in January of 2021, and of the included results, we underwent both abstract and full text screening using these inclusion and exclusion criteria. From there, the included articles underwent data extraction, where we looked at these 4 different outcomes for both regular ALT, thin ALT, and the skip flap. And then from there, statistical analysis was done comparing these 3 flaps on those 4 outcomes. So as we can see, a total of 68 articles were ultimately included, and the number to our right is the number of total flaps that were found for each of these 3. So now let's look at the results. Let's first look at complete flap survival. So what we can see here is that these 3 flaps are comparable in terms of complete survival. When looking at partial flap survival, we notice that the thin ALT is actually significantly higher in the rate of partial survival. So this could be because we had 8 articles that involved thinning of the flap right after elevation. And some evidence in the literature shows that that sort of technique can result in increased rates of marginal necrosis of the flap afterwards. In terms of full flap failure, we notice that the thin ALT has a significantly lower rate of failure compared to the regular ALT. And to our knowledge, this is the first study of its kind to demonstrate this low failure rate compared to the regular counterpart. So now looking at region of reconstruction, and unsurprisingly, the thin ALT and the skip flaps are used more commonly for foot reconstruction because they are a thinner flap. In contrast, the regular ALT is used more frequently in leg reconstruction, and this could be because the flap offers a variety of tissues like bone, nerves, and fat available for reconstruction of the leg. When looking at the reason for reconstruction, we notice that trauma-related defects often use the regular ALT, whereas in contrast, infection-related defects were often used for the thin and skip thin ALT and skip flaps. So we were thinking the reason why the trauma reconstruction involved regular ALTs is because this flap type is quite large and offers a variety of tissues that may be appropriate for trauma reconstruction. So when we look at the region of reconstruction as well as the type of wound and see whether they have any influence on the rate of flap failure, we have found that there was no significant difference when accounting for these 2 different subgroups on flap failure. Now looking at lastly, the secondary complications. First, looking at the rate of revision, where the definition is seen at the bottom of this slide. We notice that the thin ALT and the skip flaps also both have significantly lower rates of revision compared to the regular ALT flap. And as well, the skip flap has a lower incidence of needing thinning afterwards compared to the regular ALT flap as well.
So in summary, what are clinical takeaways from all of that? So firstly, that we can now say with confidence that the thin ALT is comparable in overall survival to a regular ALT flap. We can also say that the thin ALT flap has significantly lower rates of flap failure. And again, as Erica mentioned, this is the first study to demonstrate that. And although it has higher rates of partial flap survival compared to regular ALTs, that might be brought down to surgical technique. The thin ALT and skip are commonly used for foot reconstruction and electively planned surgeries such as diabetes and infection, which are usually in the foot and ankle region, and that's due to their inherent thinness. We heard that the regular ALT is used for trauma-related surgeries due to its larger size and variety of subdermal tissue that's collected. And then lastly, we're also demonstrated that thin ALT and skip flaps have significantly lower rates of revision compared to regular ALT flaps, which might ultimately be a deciding factor clinically. And thank you very much for your time.